Hey everybody, I'm Caitlin. I'm going to be reviewing a question from the current free 120 for step one. Today we'll be doing question 20. So I usually like to start by reading the last sentence of every question and just glancing at the answer choices just to kind of see what we're dealing with. So, compared with a woman of the same age whose weight is normal, which of the following serum abnormalities is most likely in this patient? And as I glance at the answer choices, I see that for me, this is a trickier type of question just because it's sometimes hard for me to keep straight all of the increase this and decrease that. But overall, it looks like we're dealing with maybe some sort of endocrine question based off of the insulin and the growth hormone and the thyroid possible answers. So let's go ahead and read it for all of the information we need. A 54-year-old woman comes to the physician because she would like to lose weight. She has been on numerous diets in the past with limited success. Both her parents have type 2 diabetes. She is 5'3" tall and weighs 152 pounds. Her BMI is 27. Her blood pressure is 140/90. Fasting serum glucose concentration is 102. Compared with a woman of the same age whose weight is normal, which of the following serum abnormalities is most likely in this patient? And we have decreased cholesterol excretion, decreased estrogen concentration, decreased leptin concentration, increased fasting insulin concentration, increased growth hormone concentration, or increased thyroid stimulating hormone concentration, which sounds like a lot. And so on questions like these, I really just start at the top of the answer choices and work my way down and try to reason with those. I know from the question stem, we're kind of dealing with something that's feeling a little bit like a metabolic syndrome. And what I mean by that is I've highlighted here that she's got, middle-aged woman, but she's got an elevated blood pressure, an elevated BMI, and maybe some insulin resistance going on because she has an increased fasting serum glucose concentration. So in my mind, that's kind of what I'm focusing on because that's the main thing they focused on in the question stem. So decreased cholesterol excretion, that one's not really, sticking out to me there, but I wouldn't necessarily cross it off yet. Um, and then B, decreased estrogen concentration. In my head, that's saying incorrect because I know in patients that have a higher BMI or adipose tissue content, that actually increases their estrogen content. So that would be increased in this patient. And then decreased leptin concentration. I know that that is incorrect just based off of the higher BMI. And then increased fasting insulin concentration. This one kind of sticks out to me as being a possible choice simply because so when she's fasting, she's going to have a higher glucose than someone compared with a woman of the same age, which I think is another important component of this question. We're comparing her to a woman of the same age with a normal weight. So our patient is going to have a higher fasting serum glucose, and she does. Therefore, the insulin while she's fasting would be higher too. So I'm going to keep D in the front of my mind. And then E, increased growth hormone concentration, not really sticking out here. She doesn't have any sequela of that or anything that would lead me towards, picking that for an answer choice. And then for F, increased thyroid stimulating hormone concentration. I know that thyroid stimulating hormone can be, involved in metabolic syndrome and insulin resistance, but I don't think that this is the most likely abnormality in this patient, at least at this time, and it does ask us the most likely. So that would kind of lead me back towards selecting increased fasting insulin concentration, and that's primarily because I can, believe it's true based off of what they gave me in the question stem. So I know that her increased fasting insulin concentration will be higher simply because her fasting serum glucose concentration is higher compared with a woman of the same age whose weight is normal. I hope this helps. If you have any questions, please let me know.